Well, hi there. Thank you so much for joining us for our long-term care planning considerations and questions webinar. My name is Jessica Zawadzki. I am the program specialist for ElderWatch Colorado, and I am joined by Kris Boggs. So today we are going to be talking about some of the considerations and questions that you might want to keep in mind as you're evaluating one long-term care facility versus another. And this presentation was initially part of a 4-part webinar series about long-term care planning, where we go over some of the different options when it comes to long-term care, as well as how Medicaid and Medicare play into things, as well as how to pay for things that Medicare and Medicaid do not cover. So if you're interested in seeing some of those other presentations, you can go to that link underneath the title there, www.youtube.com/@AARP Colorado. And you can move to the next slide, please, Mayan. So this presentation is brought to you by ElderWatch Colorado. We are a 20+ year partnership between AARP and the Colorado Attorney General's Office. We work to strengthen older Coloradans' financial resilience and literacy through educational content, just like this. And we also fight the financial exploitation of older Coloradans through education, outreach, data collection, and assistance through our volunteer staffed fraud victim support helpline. So even though this presentation isn't about fraud, if you or anyone you know might have experienced fraud or been the victim of a scam, go ahead and give us a phone call. Our phone number is 800-222-4444, select option 2. And Mayan, you can go to the next slide, please. So today's webinar is definitely intended to be interactive. However, I'll just ask that any questions are held until the end. And if when you do have a question, you can use that raise hand feature. Although since we're a smaller group, if for whatever reason that isn't working, it's a-okay with me if you type in the chat or just want to speak aloud. Today, I will be your primary presenter. My name is Jessica Zawadzki. I am a licensed social worker. In addition to that, I hold degrees in political science and legal studies. Prior to my work here with ElderWatch, I was primarily a mental health therapist and a program manager. And I will be joined by my special guest, Kris Boggs, who is a long-term care ombudsman. So Kris, we'd love to hear a little bit about you.
Morning. Thank you so much for inviting me. My background, I started work out of college as a child protection worker back in the day. I worked in the private sector after that for about 20 years, doing interviewing and investigative work with people who had been witness to a traumatic experience. Did that work for a long time. I worked in adult protection for about 6 years, really enjoyed that work. And now I am in the long-term care ombudsman program for people who live in assisted living and skilled nursing communities.
Awesome. Thank you, Kris. And then our Zoom helper will be Mayan, whose lovely red sweater we saw before. Mayan, what kind of volunteer work do you do? Although I know soon you'll be joining me here with Watch Network.
Well, thank you so much. Jessica and Kris, I'm interested in today's presentation. I recently decided to retire, and I have been helping AARP in the Colorado office in a number of ways, including Zoom support for virtual health and wellness / fitness classes, as well as doing some in-person presentations. And as you said, I just recently started the training to help with the FraudWatch ElderWatch team. So I'm really excited to see where my AARP journey takes me.
I'm also excited. Well, thank you both so much for being here. I'm really excited to do this presentation with the support and insight of you both. Thank you so much. We can move to that next slide, please, Mayan. All right, so today we'll be covering a lot of information when it comes to considerations and questions that you might want to keep in mind when it comes to evaluating one long-term care facility versus another. So first we'll start with, things you might want to know before you call or take a tour to kind of help you narrow down the facilities that you're looking at. After that, we'll talk about some of the considerations and questions you might want to keep in mind when it comes to what is included in your cost of stay. After that, we'll talk about some of the considerations and questions that you'll want to have when it comes to staff as well as health and safety. We will end by talking about trusting your gut and some of the other considerations that are kind of miscellaneous but might be very important to you. And then lastly, we'll talk about some of the resources that might help you in this long-term care planning journey. Next slide, please. So one of the first things that we'll talk about is what you should try to find out before you even get to a particular facility. Now, even though there have been many closures, particularly since COVID, there's still a lot of options out there, and taking some time to learn about a location before you physically get there, before you visit, can really help you save some time and narrow down those options. So one of the first things that you might want to know is around what happens if you want to leave that facility. What's the policy? If you or your loved one decide within a week that it's not a good fit, how does that differ versus if you decide in maybe 6 months to a year? You'll want to know what happens if you terminate that policy, as well as whether there's any penalties and how much notice you have to give before you decide to leave. Similarly, a very important thing that you'll want to consider is at what point, if any, you'll have to leave that facility because it's no longer able to meet you or your loved one's care needs. So, for example, if you or your loved one doesn't currently have memory care needs, but you develop them down the line, will this particular facility be able to support your care, or will you have to move to a facility with a higher level of care? Similarly, around ADLs, which are activities of daily living, so think things like feeding yourself, bathing yourself, you'll want to know whether a particular facility is able to meet those needs, should they develop, or should your need for support grow. On the subject of finances, depending on your financial situation, it might be helpful to know whether your facility of choice has Medicaid beds. Now, I won't get into what a Medicaid spend down is in this particular presentation, but again, if you want to learn more, it's on that AARP Colorado YouTube page. But a Medicaid spend down can be part of the plan when it comes to financing long-term care. And so if that's going to be part of your plan, not every facility has to have a Medicaid bed. So you'll want to know if that's an option that's available for you, because if it's not, and you end up depending on Medicaid, you'll unfortunately need to leave that facility. And then lastly, you may, and probably more than may, you should check for reports of abuse and neglect. And you can do this in a couple of different ways. For one, you can go ahead and Google for reviews or go to a review page like Yelp. You can also contact Kris and her colleagues at the Ombudsman's office, but we'll talk more about that later. And then you can also check out health department surveys. So Kris, could you tell us a little bit about those surveys, please?
Sure. So the health department is the regulatory agency for all assisted living and skilled nursing communities in Colorado. They do just regular visit surveys, and they also do complaint investigations. So those surveys are public record. And they are available at that website. Also, if you visit a community should have those surveys available to you. So there's usually a notebook at the front desk or somewhere where you can look at surveys, what kinds of complaints were received, what was the process for resolving those issues. So there's a lot of information there.
Awesome. Is there anywhere else you can think of that we should check for reports of abuse and neglect?
Besides the ombudsman program.
All right, we'll get to that one after.
Yeah, I will talk more about that later.
Fabulous. Okay, in that case, I think we're ready for the next slide. All right, so another really big piece that you'll want to look into before you get to a physical location is cost. And costs for long-term care have been rising every single year. So you can see a little bit of those changes nationally in that top graphic, but it does vary based on region, location, inclusions, exclusions, things like that, as you can see in that second graphic. Now, this is specifically for Colorado in that second graphic, but getting an understanding of what those costs are going to look like, as well as having an understanding of what the year-to-year increases have looked like, can be really, really helpful in helping you decide on a particular facility. Next slide, please. All right, and then another very important piece that kind of goes with our cost and financing is what's included, but more importantly, what's not included. So the following slides are things that you can and may want to ask when you physically get to a location and have that physical interaction with an individual. But when it comes to inclusions and exclusions, I personally was shocked when I found out about all of the things that might not be included. So it's definitely important to consider the needs of you or your loved one when you're having this conversation on site. For example, if you need medication management, incontinence helper supplies, you want to know if that's included or if that's going to be an additional fee on your bill. Additionally, things like activities, events, and the related supplies might not be included, and they may incur additional costs. Now, every facility is different, and this presentation is intended to be more of a generalist view of long-term care planning considerations and questions. But once it gets into the nitty-gritty, you might find that somewhere that seemed really, really great isn't going to be able to meet your needs without incurring a huge additional fee. So asking about costs as well as inclusions and exclusions before you reach, or excuse me, while you're at a particular location, and you can also see those things firsthand, can be incredibly helpful in making a decision between one location and another. Next slide, please. So a very important piece that may make or break a stay when it comes to long-term care is the staff. And there are many things to consider when it comes to staff, but when you think about it, these are the people who will be taking care of you or your loved one and who you will interact with every single day. So it's really important to trust your gut and kind of do a lot of observations while you are on site during that visit. So one of the first things that you may want to consider when it comes to choosing a facility is the caregiver ratio. And all that means is how many patients per each caregiver. So for example, there might be a difference in quality of care, demeanor, warmth, rapport, if a caregiver has 25 individuals to care for versus if a caregiver only has 5. Similarly, you may want to know about the training that individuals on a care team have. And this doesn't necessarily mean that you're asking to see transcripts and credentials and things like that, but consider what's important to you. So for example, if you or your loved one needs memory care and you find out that the staff who are working in memory care don't have memory care specific training or de-escalation training, that might be a red flag. Now, understanding staff turnover is also really important, as well as understanding whether a facility is fully staffed, because that might also impact those caregiver ratios. There is definitely a staffing shortage when it comes to long-term care, but understanding how that turnover works might help paint a picture of what that environment looks like, as well as the care that your loved ones will receive. Because if they're always going to be having a different caregiver, it might not be the best fit. Now, when it comes to observing staff, we want to observe their demeanor. So are people smiling? Do they look miserable? How are they interacting with residents? And additionally, how do the residents seem to feel about the staff? How does it seem like the staff is treating them? Additionally, knowing who is in the building, particularly on weekends and holidays, is very, very important. So will there always be someone there to assist in an emergency or if there's a medical issue? Is there security on site? And if so, when are they present? Now, when it comes to staffing, Kris, what can you tell us about the Colorado Adult Protection List screening? How does that impact staff?
So in Colorado, when staff apply for positions at assisted living or skilled nursing communities, there's a requirement to run their names through the Colorado Adult Protection List. And that is a list of people with substantiated findings for abuse or neglect. So that's a staff person could be on that list, and that is part of the screening for that person's employment. Jess, I'd like to add something else to
Please.
what you're observing with staff. I spoke with a daughter this morning who lives in California, who's looking for memory care for her mom in Colorado.
Mhm.
Now, she can't come and visit every community. So we talked about doing things like requesting FaceTime meetings with staff, requesting a FaceTime tour of the community, those kinds of things. Those are not unreasonable requests in any way. And certainly feel free to ask those kinds of questions.
And Kris, I know we'll talk about it a little bit in one of our next slides, but I think also the way that someone reacts to you making that reasonable request can really make or break how you feel about a location. Like, I agree with you, that doesn't sound unreasonable, but if someone really pushes back and kind of makes you feel bad about trying to do that back end work and research, that might be a red flag in itself.
And you want to meet the direct care staff, the people that are going to be with you or your loved one every day. You
Mhm.
want to meet them. That's completely reasonable.
Absolutely. Anything else you want to put on here? I agree with you.
No,
Okay,
no.
great.
Yeah, I
Next
like this.
slide. Awesome. I think we're ready for the next slide, Mayanne. Thank you, thank you. So health and safety, of course, are a huge reason that you or your loved one might be considering moving into long-term care in the first place. So it's really important to be as informed as possible on the health and safety of a prospective option. So let's start specifically with memory care. A significant difference between a memory care facility and other types of care is a secured entrance, and this is to prevent wandering risk. So generally with memory care, there is a special code you need to enter that wing or a special key, things like that. So if you're in memory care, if you're looking for prospective memory care, you want to know what the security is like. You want to know if the area is locked, and if, for example, the doors are locked or the elevator needs a specific code, are the stairwells also locked? You'll want to know who is there to help keep your loved one safe. Additionally, for memory care and dementia care specifically, it's not uncommon that individuals have difficult days, regardless of whether you have those impairments. We all have difficult days. And since you'll be in a location where staff is caregivers, you want to know how staff deals with these difficult days because they can pose health and safety risks. Asking staff how they deal with these issues should not at all be unheard of. And so if the response that you get is perhaps vague or uncertain or doesn't have the level of compassion that you or your loved one deserve, that might be a yellow or red flag. Now, regardless of the type of unit, safety and security is still important. So you'll want to learn about safety features such as handrails, emergency alerts, and the building's safety and security. And again, that's for any type of facility. Now, for more intensive care, you'll also want to know how often your loved one will be checked on. And that should, again, be something that's pretty easy for staff to answer. So if they can't answer that, that might be a problem. In some locations, this will be every couple of hours. In other locations, this will be a certain number of times per day. And this is important for emergency situations, of course. For example, if someone has fallen or had an accident, but it's also just important for human interaction. We know that there is this loneliness epidemic. Kris and I will talk a little bit more about touch and interaction in our next slide, but if your loved one is just sitting by themselves all day, even if that's not maybe an emergency situation, that's probably not great. You'll want to know that your loved one is being checked on and that you can trust the person who is coming to do those checks. Now, the last piece on our health and safety slide that I want to talk about is location. And this may seem a little out of place on a health and safety slide, but it can be very important. So for example, back to memory care, if there is a wandering risk, but the building is located near a highway, is that a potential danger? Is that, as my mom likes to say, an accident waiting to happen? Additionally, being near medical and non-medical services is worth considering when it comes to a location, as well as being near family and activities that you or your loved one enjoys, because mental health is a really important piece of health and safety, regardless of your age. Kris, is there anything else that you think is important to consider when it comes to health and safety?
Yeah, Jess, I wanted to just touch on memory care, a secure community. That is a rights restriction on a person living in a memory cared community. So because it's a rights restriction, people aren't allowed to come and go as they please. They
Mhm.
have to meet certain criteria to live in a community like that. Not just, a power of attorney can't place someone in memory care without that person meeting criteria and qualifying for memory care. So that's our probably most restrictive placement because people's rights are being restrictive. So I just wanted to throw that out.
Yeah, and that's, I mean, all the more reason why it's really important to make sure you
Mhm.
understand what that facility is like, because it's just like you said, like you have lost some of your rights, and then if you're put in, an unsafe situation, you have less recourse to get out of it. Um,
Thanks, Jess.
yeah, thank you, Kris. I think we're ready for our next slide, please. It's actually my favorite one. So this is actually my favorite slide because I kind of think it's the most important when it comes to making a decision for you specifically or your loved one. And this is trusting your gut. Now, our understanding of the world is largely informed by our five senses, and those senses, of course, inform your gut. So when it comes to our five senses, maybe the first thing that comes to mind when it comes to evaluating a facility is your sense of sight. So what do you see in each facility? How clean is it? Are there activities posted around? Is it vibrant? Is it dreary? What are the residents doing? Where are they? Are they all kind of just lined up in the hallway, or does it seem like there's an element of choice? Additionally, where are the staff? Are they interacting with residents? Are they all kind of tucked away in a break room? And how do they seem? Remember some of those things that we talked about on the staff demeanor section. So what are people's facial expressions like? How can you read their body language? Human communication is 70% nonverbal communication. So using your sense of sight as well as your other senses can really help inform you on what a location is actually going to be like. Now, when it comes to smell, if you smell urine or feces, this might give you pause. It might not necessarily be an emergency situation if it's isolated to one location or one individual, but if you smell it everywhere, that might be a health and safety issue. That is probably not ideal. Furthermore, with smell, what other smells do you smell? Is it pleasant? Does it smell musty? Does it smell mildewy? And whatever smell that is, can you imagine yourself or your loved one smelling that smell every single day? And when it comes to sound, very obviously, what do you hear? Do you hear people laughing and chatting? Is it completely silent? Do you only hear TVs and nothing else? Do you hear people crying out for help or just sounding really upset? When it comes to taste, you can use the sense as well, and you probably should. And I don't want you to lick the walls or anything like that, but consider food. So what, if you're allowed to have some food, what does it taste like? What does the food on other people's plates look like? Does it look well balanced? Does it look yucky? Are they kind of just like playing around with it and not actually eating it? Does it look well balanced? These are all, technically, I guess that's sight, but these are all things that are going to be important when it comes to your sense of taste. Now, touch might seem kind of odd as well for helping you evaluate a location, but it could mean anything from the comfort of common areas, from whether the walls and doors feel sticky. Now, Kris, you and I had a really great conversation about touch and its place in long-term care facilities. So what comes to mind when we talk about touch?
Yeah, I actually um, looked into some of the information that I have, and I actually searched some medical journals this morning, just how important physical touch is for people. Um, so one of the things I observe when I'm in communities is our staff touching residents compassionately and kindly. Um, are residents responding that that's a comfortable thing? Are staff reading cues like maybe they touch a shoulder and a resident responds and don't feel comfortable, but the staff doesn't read that cue and interact and remove their hand, that kind of thing. So physical touch, I pay attention to that. I'm not even going to go into everything I read this morning, but gosh, just the importance of touch in um, especially in with dementia patients or people who are agitated, it can be very calming. I will in communities, people often reach out their hands to hold my hand. That kind of touch, I will engage with that. So I would just be observant about that and just how important it is. Just a story from child protection. Um, when I first started out, one of the things that we did with parents was work on touching babies and how to comfort babies
Oxytocin.
with physical touch and
Yep.
how we kind of automatically do that and just how important and primal and instinct that is for everyone. So
Oh
there's so
yeah.
much information.
And I mean, yeah, whether it's, I think a lot of these things are not just for long-term care planning. Like it's important to trust your gut and be in tune with your senses for all of these. But when we think about biofeedback and grounding, and I agree completely, like just touch in itself can make such a huge difference, especially when we have, this loneliness epidemic. And if nobody's coming to visit you, even just holding the hand of Kris Boggs might really make a huge difference in your day.
Jess, I want to add to taste as well. It's
Yes.
completely reasonable to request to have a meal, to request to taste something, to request to, yeah, during your visit to have a meal there. That's completely reasonable. Some communities may charge you, some communities may not, but that's a reasonable request. To food is important. I
Yeah.
field a lot of food complaints. It's important.
Well, and I think too, if, staff tells you, no, you can't taste something, that's another red flag. Like finding how they react to these things can be hugely informative. Anything else on those five senses before I get into the last bullet?
No,
Okay.
thanks.
Yeah, of course. Thank you. And then kind of, going back to trusting your gut and holistically being in tune with our senses is, how does it make you feel? It's okay to make a decision based on how a location makes you feel, because again, this is somewhere that you or your loved one is going to be long term. So if from the jump you don't feel good about it, you should listen to that sense. And then additionally, you should consider what makes a particular community stand out versus the other, positively or negatively. One thing that I like to tell people is, when you get into the community, when you walk through the doors, do you feel welcomed? Do you feel anxious when you get there? And if you feel anxious in the beginning, do you feel more or less anxious in the middle? Do you feel more or less anxious after you leave and have finished viewing that facility? That's really important to listen to. Did the space make you feel depressed? Did the space make you feel hopeless? Did it make you feel hopeful? Was it exciting? All of these things are very important considerations. Next slide, please. All right, and then these are some miscellaneous considerations that I think are helpful, but they don't necessarily fall into one of those categories. So the first one that I have here is around spirituality. So if that is important to you or a loved one, you'll want to know about what that looks like within this community. Now, some communities may have these services in-house, or they may come to visit in-house. But if they're not, you'll want to know how you or your loved one can get to that place, whether, again, transportation is included or not. And then if it's not included, if these services are not included, that location, that proximity might also make a big difference to you. Another thing you want to think about is the size of a community. What appeals to you or your loved one? Do you want only 3 to 4 neighbors and, it's just a little bit more quiet? Or do you want a really vibrant location where you have hundreds of neighbors and social activities and people always in the common rooms? Everyone is different and your needs are going to vary as well. Now, you may also want to know whether the person guiding your tour works on commission. And Kris and I had a really great conversation about this that we'll also bring to you in just a sec. I'm not saying that one is better or worse. I'm not saying it's you want a place that works on commission or you don't want a place that works on commission. But if someone is working on commission and it doesn't seem like they're listening to you, this kind of just feels like a sales pitch, you're getting vague, canned responses, that might be cause for concern. So, Kris, if you're touring with a marketing or admissions individual, are you allowed to talk to anybody else?
Absolutely. I don't know if I apologized. I popped a cough drop in my mouth when I was coughing before we got started. So anyway, I always encourage families and people looking at care communities to ask to speak with direct staff. Those are the people that are interacting with your loved one every day. It's absolutely okay for you to speak with direct staff. Ask direct staff questions about what happens if someone calls in sick, what happens with staffing, those kinds of things. You should be able to speak with direct staff um, to ask those questions and not just be talking to an admissions person, and to
And
share your loved one's needs. If you're speaking with direct staff and talking about, my my mother has a very specific care need, like she has a spirituality meeting once a week and needs to be have her wheelchair assistance to get to that meeting. Speak with direct care staff about that. They do the logistics.
one thing, Kris, that you and I also talked about that I thought was really interesting is sometimes there's a discrepancy between the marketing staff and the direct care staff. So marketing staff won't necessarily know the care staff. So if you get one answer, for example, on being able to provide transportation, you get one answer from the marketing staff and a different answer from the caregiving staff. That's an issue, but it's not unheard of. Generally, they're kind of or not generally, they can be separate entities. So it's important to make sure that you get that broad picture because the marketing staff's job is to be marketing staff. They're salespeople when it's a commission-based situation.
Mm.
Anything
Thanks,
else?
Jess.
Yeah, thank you. Anything else on this other slide, Kris?
No.
Okay, cool beans. So then I think we're ready for the next one, Mayanne. So at this point, we have covered a lot of things that you might want to consider in making a long-term care placement decision. And it's a lot. It is I like to say, a cornucopia of considerations. So if you are feeling overwhelmed by this process, a placement agency may be helpful to you. Usually, this is a free service, and a placement agency in this context will listen to your needs and desires. Sometimes they'll have their own assessments to help determine the best type of facility for you, and they'll really help you narrow down your list of options to some that they have already vetted and or have relationships with. Now, if you do choose to engage with a placement facility, definitely do some research on them as well before you choose one. There are a lot of different options. We don't often get calls at ElderWatch related to fraud or scams with placement facilities, but it's still a thing that happens every once in a while. So just doing some research, looking at those reviews, and shopping around for a placement facility can be very helpful in helping you find the right one. Now, one way that you can help find a placement agency is through the Seniors Blue Book. So for the Denver area, I have listed that resource on this last page, but it's not just limited to Denver. So this is definitely one resource that you can use. Now, Kris, I hear that you also interact with placement agencies in your role and might have some other ideas on finding a good placement agency. So can you tell us a little bit more about how placement agencies and the Ombudsman's office work together, and maybe if there's anywhere else to find a placement agency?
You bet. We at the Ombudsman program, we field a lot of calls from agencies contacting us for general information about complaint history and that kind of stuff. We're able to provide that information to the community. So we have placement agencies calling us, you know, what's going on at this community? Have you had complaints? What's the most recent survey? Those kinds of things. So we do interact with placement agencies quite often. Some of the other ideas I had for finding placement agencies are to ask your loved one's direct care provider, their doctor.
Mhm.
Ask the doctor's office, what placement agencies have you worked with? Are you familiar with? Have you had good luck with? Another thing is at the hospital, if your loved one is in the hospital, asking case management, what
Mhm.
placement agencies do you work with or do you recommend? The Ombudsman program, we do not make recommendations, but um, you can ask at doctor's offices, hospitals, all of that kind of thing to try to get some more information about placement agencies. There are a lot of placement agencies to look at.
And I think that's a perfect segue to our next slide, Mayanne, if you wouldn't mind.
Oh,
All right, so Kris, how can the Area Agency on Aging's Ombudsman program help us with all of the stuff that we've talked about?
you, Jess. I wrote down so much for you all, but I'm going to try to just give me the hook when I should stop talking. So I am with the Area Agency on Aging. There are 16 area agencies on aging in Colorado. I'm going to start saying AAA, AAA, just because it's easier to say than Area Agency on Aging. Um, um, these agencies, I wanted to give you some examples of overall of what our AAA does. And we office at the Denver Regional Council of Governments and pretty much cover the metro area north to south, areas in Douglas County. We go way east. So we cover a large part of the Denver area. But the Area Agency on Aging at DRCOG covers aging and disability resources. Information and assistance. If you have any questions on anything aging, that's a great phone number right there. Those people that answer that phone, I call them for resources. They know a little bit about everything and can get you connected in the right direction. Our AAA provides case management for older adults to obtain services and benefits. We have a program for older refugees. We have a caregiver support program. We have a choice service program. That's a program that offers like housekeeping, laundry assistance, grocery shopping, non-skilled services like bathing and dressing. We have a veterans directed program. So anyway, there are a lot of programs within our Area Agency on Aging. So that general number is just a great resource for all kinds of things. So I am an ombudsman with the Long-Term Care Ombudsman Program. That word ombudsman comes from a Swedish word which means speaking on behalf of another. So I am a resident advocate. My last name is Boggs, and I was actually called an ombudsman one time, which I thought was very funny. So the authority of this program comes through federal legislation from 1975 and the Older Americans Act. So this program has been around a long time. This program is very different from adult protective services or law enforcement. We are strictly an advocacy-based program, and we are resident permission-based and directed. We also advocate for the expressed interest of residents and not best interest. So the difference between that, when I was working in adult protection, there were a lot of laws and regulations and rules for people, and I was acting on best interest and not expressed interest. So not necessarily what the person wanted, but we had that kind of authority. But in the ombudsman program, it's really about the resident, their quality of life, and their direction. So we work as resident advocates. Every discussion that I have with a resident living in an assisted living or skilled nursing community is confidential. I have to have permission from that person to advocate on their behalf and speak with staff or family or whoever they would like me to speak with. Um, so that's a very special relationship. I'm not a mandatory reporter, so that any discussions I have with people are confidential. Um, Really, my job, we investigate complaints that we receive, and we get complaints on food, lots of food complaints, maybe call light delay, that sort of thing, and facilitate a resolution. We are not a regulatory agency. Like the health department is a regulatory agency. The ombudsman program, we are not a regulatory agency. So really my job is to facilitate resolution that's acceptable to the resident. In 2023, we at Dr. Cog in the Ombudsman program, we investigated 4,711 complaints.
Wow.
So we have a team of about 15. Not all of us are direct field investigators. Also, part of my job is also as a resource to the community. So I can provide general information, historical complaint information, and that kind of thing on my communities with people just calling in from the public. This woman calling in from California this morning looking for memory care. I could provide her information on the specific communities she was looking at, as far as how often am I out there for complaints? When was the last health department survey? Were there any citations from the health department? We also keep a database at the Ombudsman program, and that is a database of all of the assisted living and skilled nursing communities in our area. And we can filter that database and provide copies to people in the community. And we can filter by Medicaid insurance. We can filter by skilled communities. We can filter by memory care communities. We can filter by locations and neighborhoods. I always talk with families about let's look at locations closest to people who will be visiting.
So
Let's
Kris,
see.
if I can ask really quickly, so if, for example, I'm looking for memory care for myself, can I call you to help me kind of narrow down
Absolutely.
that list?
Absolutely, absolutely. And I'll ask you lots of questions to kind of filter out what you're looking for. But absolutely. And then we provide those lists. I also provide every ombudsman assigned to each community and their phone number so that you're able to contact and speak with the ombudsman directly. I am in my communities. I have about almost maybe 48 communities. I'm in my communities a minimum of quarterly. I'm really in my communities much more often. So we are there all the time. We have eyes on. Um, Part of my role as an ombudsman is also as an educator. We provide training for residents, family staff. I have a new training, a new dementia training for families that I've been presenting to families in memory care with loved ones in memory care communities. So that's part of the responsibility of the ombudsman as well, is to provide community education. Let's see. Oh, Jessica, I have a little list of tips. I'd just like to add a couple of tips. Am I okay on
Sure.
time?
Yeah, I think we have 2 more minutes and then we'll go to questions.
Okay, so one of the things that I do when I get a call from the community, this woman from California, is I have a little packet of information that I send out. Information including what kinds of questions to ask when you're looking at communities. Um, um, so, um, So some of the tips that I have for looking at communities is get a list of all of the licensed communities. You can get a list from the health department. You can get a list from the ombudsman program. Now, the health department does consult with the ombudsman program when they are doing surveys or investigating a complaint. So we do communicate with the health department. During your tour, yeah, cleanliness. Jessica talked about cleanliness. Look about cleanliness. Odors are a big deal. I had a woman say to me the other day that her grandchildren are not visiting because of the odors. Well, that's huge to me. And Even clean communities, there can be odors, but I expect that trash to go right out right away, that kind of thing. Look if residents have privacy. Do they have a place of privacy for themselves? When you visit the community, locate the state license. There are requirements that the state license should be posted. The ombudsman poster should be posted. Resident rights should be posted. There's a lot of information that should be on walls for you to see. And if I can't see it, I ask, where is all this stuff? Because if I can't find it, maybe other people can't find it as well. So look for all of those things. Let's see. Oh, when you go to a community, you can ask to see health department surveys. We talked about that before, and usually there's a binder with health department surveys, and you can look at what kinds of complaints the health department has investigated and all of that. A lot of information. Look to see if residents look groomed and cared for. A lot of my communities that I go in, residents, their hair is done to their specifications, that kind of stuff. I look for that. That's meaningful. Observing that interaction between staff and residents, I think, is a really good thing to pay attention to. And requesting to meet the administrator. If you're, or the house manager, if you're looking at a small community, I want to meet the house manager. I want to meet the administrator here at this community. I think that's really important. And again, a really reasonable request when you're looking for care for yourself or for a loved one.
And then, Kris, we do have to move on to questions, but you can do one more.
No, Jessica, that's all I had. I'm ready for questions.
Oh, perfect. Okay. Then Diana, if you want to, perfect. All right. Well, thank you so much for joining us. I know we covered a lot. Eric, I did see that you had some questions in the chat that I didn't get to because I was talking, but I would love it if you would like to ask them aloud.
Ooh.
Man, is he able to? Oh, there we go.
All right. I'll have to look back at them because sometimes I have cognitive decline as well.
That's okay. I understand.
Let's see here. First question was, does every state have a protection list? Like a protection. You mentioned that Colorado has a protection list for when you're onboarding potential employees. Does every state likely have a similar list?
Do you know, Eric, it's Kris. I don't know the answer to that question. Yikes. I don't know about that. I believe that is specific to Colorado, and I do believe probably other states have that, but that system is specific to Colorado, like the child abuse registry in Colorado is specific to Colorado. So I don't know about other states, but that is worth asking. What kind of screenings are done on employees before they're hired?
Okay.
Eric, I don't know if I realized because ElderWatch is Colorado based, though AARP obviously is national and we have partners nationally. So I should ask, where are you joining us from?
I'm joining you from Wisconsin.
Oh, okay, awesome. Well, we're super glad to have you then.
Okay.
Yeah, we'll have to look into that, but it's definitely worth asking for sure. Sorry that we only have the Colorado specific answer.
No, I've enjoyed numerous state, I don't know exactly how you guys term it, but I've listened to many state-specific ARP presentations, so I'm used to presentations being singularly state-focused, so
Thank
no
you for
problem there.
understanding. Okay.
My next question was, does ARP Colorado, ARP National, or any other state ARP have a comprehensive worksheet / checklist to use while visiting facilities?
I can make you one. You will. I think this also kind of dovetails into your other question, which is, will this recording be emailed? I appreciate you're all LOL attendees. In which case, yeah, I can email. I will give you this presentation, so you'll kind of have a what's it called? I can send you a PDF copy so that you'll have that as you or whoever is touring that location. that's a really good idea in terms of, I'm going to write that down because I didn't think about that. And I really like this idea of it being maybe not like a checklist, but like a little workbook that you can fill out. So I think that's a great idea.
Yes, I have some, and Eric, I have some information too, just kind of some those basic kind of checklisty, ask these kind of questions, look at these kinds of things. I do have that. Jess, I'll send you that and um, while you're developing something.
Fabulous.
That'd be great. It'd be kind of funny to actually go in with
Mhm.
a potential client would end up looking like a state inspector. Go in with a clipboard and go, mm-hmm, mm-hmm.
But you should, right? Because I mean,
Absolutely.
this is so important, and long-term care touches so many aspects of our lives, but it's not just, like where you sleep, it's also what you do for fun, it's also your comfort, it's also your spiritual connection, it's your health. So you should go in looking like a state inspector, frankly, because you matter, and it's important that you or whoever you're looking for is treated accordingly. You deserve it.
Right. I'll finish on this. So my significant other is a oldest daughter. So her caregiving has been primary and mandatory. And I'm a youngest son. So my caregiving has been secondary. So we've led typical caregiver roles.
Mm.
That's
So
all.
Eric, I'm curious, did you join this because you're interested in long-term care considerations and questions for yourself or for caregiving?
Actually, to be completely transparent, I thought this was going to be LTC insurance related, but
Oh,
but it has been a nice review for both myself as well as my significant other. My significant other suddenly became the primary caregiver for her mother when her father passed away 6 years ago. So your presentation, she learned, shall we say, the hard way, organically. But it was a nice, this last hour was a good, yep, that's what you got to learn because that's what I had to learn kind of thing for her.
yeah. Well,
For
I will
me,
say, Eric, if you do go to that YouTube AARP Colorado, I touch a little bit on how to pay for things that Medicaid and Medicare don't cover. And so I talk a little bit about long-term care insurance. I will say, and I can't see you, so I have no idea about who you are, but it is definitely one of those things that you want to get as early as possible. The rates go up significantly as you get closer to needing long-term care. But unfortunately, you can't apply for long-term care insurance after you're already in long-term care. You have to have it established ahead of time. So like I said, it is on the YouTube AARP Colorado under the long-term care planning, how to pay for things that insurance doesn't cover. And there's a really great Forbes article as well on that topic that I mentioned in that presentation.
sure. All right. Thank you very much. Appreciate it.
Absolutely. Anything else from anybody with our 2 minutes left?
Eric, for joining us.
Um,
Mhm.
does this go out to other people that registered, or was there only one registered person as well?
Yeah, we'll definitely send this out to you. And then we did have some other attendees register, but within AARP, there's like a couple different things happening all at this same time. So I'm not surprised that we didn't get as much attendance-wise as we expected, but this will definitely come out to you within 24 to 48 hours. Given that it's Thursday, you might get it on Monday, but we'll definitely send it out to you.
I've never been the solo attendee. Do I get a participations
I think,
certificate?
you know what, I can give you every single reaction that I have,
Oh, that's
and
awesome.
they're
Wow,
just for you because
that's great. Yeah, I'm gonna keep this recording forever.
you, and I hope that, I know you said that you had a loved one go through this and they had to learn organically, but I hope that, whether it's for you, or I know you said your wife has become a caregiver, or I'm sure there's, people in our community, all of this information is I think, very helpful and not really talked about and very stigmatized. So even if it doesn't help you specifically, I hope that this is able to help someone else in your life.
Sure, absolutely. I appreciate you guys pretending like it was a large group.
Well, you are a VIP, so it wasn't much pretending at all.
Did I get a real close parking space too?
Yeah, absolutely.
Okay, thanks. Appreciate it.
Well,
I
thank you
just
so
want
much.
to jump in real quick and say that one of our other attendees, Paul D, says, "Hey, I'm here too." So, Paul, we
Oh.
appreciate you jumping in and letting us know that you are here as well. And the information that Jess just provided to Eric will also apply to you. You will also get an email with the link and any additional information. We'll make sure it's a well-rounded, well-crafted email to everyone who is attending or who registered today.
So I'm not special after all.
Well, you were here first, so you're still very special.
Okay, thanks. I appreciate it. All right. I'm gonna mute myself now.
Well, on that note, it is 1 o'clock, which was my ending time. So if there's nothing else, we'll call it a day. Thank you, Eric and Paul and Mayanne and Kris, for joining me today. I really am grateful for your time. This is a topic that very few people want to talk about until it's time to talk about it. And by then it's too late. So even though we were a small group, I feel that we are a mighty group. And, I really am grateful that y'all were here. So thank you so much. Enjoy the rest of your Thursday, and we'll see you next time.
Thanks, Jess.
And Mayanne and Kris, if you want to hang on for just a sec, that would be great.